Hello, I'm Lisa Tyler, host of Senior Connections. This is your monthly show hosted by Senior Resources, which is your local area agency on aging. We're here every month to talk about different topics that we hope are of interest to you in what can be a kind of a confusing world of nonprofit services and things out there, from Medicare assistance to volunteer opportunities to at-home care and a variety of things like that. So today I'm really excited to have a couple of wonderful ladies with me, and we are going to talk about the Senior Corps programs, which are part of the Corporation for National and Community Service. With me today is LaTanya Bean, who is the director of the Retired and Senior Volunteer Program, otherwise known as RSVP, and Beth Scheel, who is the director of Foster Grandparents and Senior Companions programs that are sponsored by Catholic Charities West Michigan. Welcome, ladies.
Thank you.
Thanks for coming today. So let's talk just a little bit about, I'm just going to hit it up right off the bat and we'll maybe come back to it. Senior Corps programs are those three programs that we mentioned: RSVP, Foster Grandparents, and Senior Companions. And those are programs for people who are 55 and older. They're wonderful programs. We're fortunate to have all three of them here in Muskegon County. But quite honestly, they're in a little danger. They are up for elimination, as is the whole Corporation for National and Community Service, in President Trump's proposed budget. And so I'm going to just say right up front that if you hear this program and this is important to you, please get a hold of your lawmakers, and you can find their contact information on our website, www.seniorresourceswmi.org. If you go under advocacy, we have a list of all of that. We'll come back to that if we have time, but I just wanted to get that out front. These programs are vital. I think you'll understand that after we talk a little bit. So, sorry, I just had to get on my soapbox a little bit.
We appreciate that.
Absolutely.
So, but let's try to get to know the two of you and the programs that you so well represent. Beth, we'll start with you. Tell us a little bit about yourself, how long you've been director of these great programs.
Well, I've been director at Catholic Charities West Michigan Senior Corps program for 8 months. I started in November of last year, and the programs that I direct are the Foster Grandparent Program and the Senior Companion Programs. My background is actually in healthcare. I was a patient advocate for over 15 years with a community health center, and it's been a great combination to come to this program from that background.
What made you decide to make that change?
I really like the program as far as the social service aspect of it, working with the volunteers and with the clients. It's a different field. It was time for a change, and it was really a great step forward for me.
Great. Interesting, because there's a little parallel between you two, because LaTanya and I have known each other for a number of years when we used to work together. And you also had a background in health. That was what you studied at MSU. So LaTanya, tell us, I know more about you, but tell our viewers a little bit more about you and how you came to be at RSVP.
Absolutely. So I was born and raised here in Muskegon, Muskegon Heights. So I'm a graduate of Muskegon Heights High School. Went on to Michigan State University.
Go Spartans.
Go Spartans. After graduating, I immediately came back to the community and entered the world of substance abuse, so counseling, case management. I also did a little bit of HIV prevention counseling. After that, it was kind of right into the federal program. So I started off with the Upward Bound program out at Muskegon Community College, which is also, like I mentioned, a federal program under the TRIO label. And then I was so graciously entered into the world of United Way. So I served under a capacity of community impact for a couple of years and college access. From then, we kind of migrated into the Senior Corps arena, and so I've been in that arena first as the coordinator for a year, and now as the director for a little bit over a year now.
Great. So both of you, interestingly, have just very divergent the health backgrounds, but come into both of these working with seniors. So same with me. I mean, my background wasn't with that, but you become very passionate about it very quickly.
Absolutely.
I think. And plus, we all hope to get to that age, don't we?
Yes.
And that is really our goal, and we want to.
Yes.
I mean, when I look at things, I will look at what do I want things to be. I'm not quite to your program age eligibility yet, but I'm close. But I want to make sure that there are things that keep me vibrant and alive, and all of the people that I know around me, because that's really what our goals are. So, as we mentioned, all three of these programs are part of Senior Corps, which is funded by the Corporation for National and Community Service. The Senior Corps programs connect today's 55 and older population with people and organizations that need them. It was conceived during John F. Kennedy's presidency, and those 3 programs under Senior Corps are Foster Grandparents, Senior Companion, which are Beth's programs, and RSVP. And as I said, we're really lucky to have them. So let's talk about some specifics, because they do have different focus, even the 2 that you run there. So Beth, let's talk about yours. What requirements are there for eligibility for foster grandparents and senior companions? Then we'll get into the specific differences.
Sure. With both programs, for volunteers to be a part of the programs, they have to, like you said, be age 55 or older. They have to meet income guidelines, which is under 200% of the federal poverty guideline. They have to agree to background checks. We're very careful as an agency, making sure that people are safe out volunteering and with those that they're volunteering with. And they have to be willing to work or volunteer at least 20 hours a week in order to do those programs.
Okay, so then let's get into some specifics. Talk to us about foster grandparents and what is its mission?
Okay, so foster grandparents is really an opportunity for the seniors to go into the schools and work with children that may need a little extra assistance with literacy or math skills. They work with children that might have some behavioral issues. It's really a support for the teacher in the school, and that extra listening ear, extra support for the student, really encouragement for the student so that they can succeed in school.
Is it more lower elementary than upper elementary?
We do, the majority of our volunteers do go into K through 5th grade. We do have some volunteers in a middle school also, and then there's some in the Head Start programs. Yeah.
So we're really kind of targeting 3, 4 on the youngest end up to 10,
Yes,
11?
probably 10, 11 would be top, yeah, yeah.
Now, I have had the privilege of doing some conversations with some of the foster grandparents
Yeah.
and your senior companions to hear what they like about it. But tell me a little bit about what do you hear from your foster grandparents and from the kids, because one of the things I love about that program is the dual focus of the seniors, which is what those 2 programs started. They really were about the focus on the seniors, and now they've kind of migrated. All of the Senior Corps programs have kind of migrated in their focus a little bit.
Yeah, in the foster grandparent program, sometimes the foster grandparent in the classroom is that one person that's really going to listen to them. And most of the children don't even know the volunteer's real name. It's Granny or foster grandma or but you know, it's that person that smiles at me and says a warm hello in the morning, and that person that's going to sit down with me and help me through the challenges during my school day. Sometimes it might be the only hug a child might get that day. So it really is an important piece in that child's life, and the kids, we go in and do site visits, and they're all excited to tell us about their foster granny. So, and the grandmas themselves are very passionate about what they do, very committed. We have foster grandparents that do a full 40-hour week. I find that challenging myself to go into a classroom full of little ones and keep up with them, but these foster grandmas love it. They can't say enough good about it, and it's just the quality of the volunteers that we get too, and I give them credit for what they do because it really is hard. Very fulfilling, but yeah, it's a challenge.
If you ever go into one of the classrooms, they're identified, they usually have a red vest.
Yes, yep, they wear a red vest and name tag. The sites that our foster grandparents are in have a sign that identifies that classroom as a classroom that utilizes a foster grandparent. So it's, you know, everybody knows, the parents are aware, schools are aware of who's in their buildings.
Great. Let's talk a little bit about Senior Companions
Yes.
then. What's the mission of that?
Senior Companions are volunteers who will go into the home of frail seniors or people that may not be able to meet their challenges that they live with every day. If they need a ride to get groceries, or if they want somebody to come and put a puzzle together with them, or just have that companionship, that program, that volunteer would be able to assist with that. We do say that the clients need to be referred by a case-managed facility. So Senior Resources in Muskegon is our resource for getting clients. And our program coordinator coordinates that program very well with the case managers at Senior Resources. But it really, with the Senior Companion Program, it is a very special program, much needed program. We're all getting up there. We're all going to be in that age group someday where we're going to need just that extra assistance. We're really trying to keep people in their homes longer without having to go into assisted living or going into those expensive nursing homes. And it really is an opportunity for that Senior Companion to give respite caretakers to give them a little bit of a break so that they can go out and maybe have some time to themselves and get refreshed and be able to come back and care for that person.
It's very much in line with the Senior Resources mission, which is
Yes.
we're all about trying to keep people at home for as long
Yes.
as possible.
Yeah.
It's what most people want, and it's certainly much more cost effective.
Yes.
How long have
absolutely.
those two programs been around in the country?
The foster grandparent program was developed in 1965, and then the Senior Companion program was developed in 1974.
So they've both got a long history.
Long history, and actually the programs within Catholic Charities West Michigan themselves have been around for 30 plus years.
So they're obviously valuable. in the
They're
community.
valuable, and they are proven to work.
Right.
Yes.
So we'll come back and talk about a little bit more about those. But, well, actually, let's, before, because I think it'll get confusing if we go back and forth. Tell me a little bit about what are the perks? What reason would somebody become a foster grandparent or a senior companion?
Besides just the knowledge that you're doing something great for your community and that self gratification, you, as a volunteer, get training in different areas that pertain to your service. So there's a required 4 hours a month of training that goes into being a volunteer. But on top of that, the socialization with other volunteers. We have recognition dinners, recognition events, trips that they go on. You get, in our programs, because it is income-based, you do get a stipend, which is a fee for being able to volunteer. It's really meant to break down barriers to volunteering.
People don't always realize there's a cost to volunteering.
Absolutely, yeah.
And can we share what that stipend
Yes.
is? Because it's low.
It's not a secret. So
And it hasn't changed
and it
in the
has not.
25 plus years I've known this program.
Yes, yeah, it is $2.65 an hour.
So nobody is getting rich off
Nobody
of this
is getting rich off of this program, no, but it does help a person be able to do something for other people with that money. And they also
They
get
have comfortable
Yeah.
shoes. They have
Yeah.
appropriate winter wear when they're getting out that help with transportation.
Yep.
Or that little bit of help they need to make sure they can get a prescription filled.
Absolutely, yep. It's not meant to be a job. So I think that's important to say because it really is a supplement to what one gets. But you get paid mileage when you're going to and from your sites. It's, I think, just the camaraderie you have with other volunteers is, it's a great payoff. So.
Absolutely. So let's now talk a little bit, LaTanya, about your program, the Retired and Senior Volunteer Program, or RSVP. You've got the same age requirement, 55 or older, but you don't have the income eligibility requirement.
Don't
correct?
have the income eligibility. Much similar to the foster grandparent and senior companions, we are geared towards that 55 and up. We would like to bring in that seasoned professional or, any walk of life really, who is at that age, who is looking to get back into the community through a volunteer program. I think we kind of pride ourselves on being able to be the matchmaking source or the pipeline to get individuals into areas that they're interested in, whether you're looking to learn something new or you're looking to use skills that you've utilized in your professional walk. We take you all. We'll take them all, and we hope to implant you in an area that interests you and you want to really implant or, adapt for your own.
And so RSVP has also changed a lot since it's been in Muskegon. It's been in Muskegon for quite a while.
Yeah, dating back to the early 1970s.
Okay. I know from knowing it for a lot of those years, it's changed a lot. We used to have, for example, groups of women, primarily women, who would knit different things for agencies. But at some point, the Corporation for National Community Service changed a focus and wanted to make sure there were more outcomes and that they were helping some specific areas. So you've kind of had to pick some specific areas of focus, correct?
Absolutely. Yeah, you're absolutely on it, Lisa. We used to have the knitter clubs. We used to have the baby holders who would go into the nurseries at the hospitals. Oh yeah, oh yeah, that was a hard one, I'm sure.
Yeah.
But yeah, the corporation came in and decided that we needed to become more impact-centric or more impact-focused. And unfortunately, that meant, that a lot of the programs that we once prided ourselves on, they didn't necessarily fall into that category. We couldn't find a place where they fit. And so now we are looking to become more impact focused. We're in the schools alongside the foster grandparents there. We have opened up a little bit different channels, I guess, in getting into the schools. So much like the foster grandparents program, you find us in the classroom, after school programs, just anywhere we can be of assistance. There are some lunch reading time, buddy type situations going on in the schools now. And so the RSVP program members want to go ahead and be as valuable as they can and add in any support of areas that may not be afforded by schools.
We've got some health focus because I believe we have somebody who comes to Tanglewood Park
Oh, absolutely.
every Monday who does blood pressure checks.
Absolutely.
I think I just saw her yesterday. And I think we've had a couple with our Medicare Medicaid assistance program that also came through you. And then we've still got some of the more traditional ones where we've got people that are helping at some of our historical sites in the community, right?
Yes.
So we didn't have to get rid of everything. But
So if you're
more
into
focus on-
theater, I mean, we try to cover a lot of our basic community need areas. So that being education being one, health being another. So even within that frame, you may find us out at the pantries with adding food support, or you may find us at the hospitals. We may be sitting at the front desk. We may be in some clerical positions. So, it's a wide variety. We're located at over 20 station sites right now. And so going into our next year, which starts July 1, we're looking to even open that up a little wider. Cast our nets a little wider to capture more even, and create a support system for more community need areas.
And I think it's really important. We have a lot of people in the community who are retiring and some who are fortunate and able to retire a little earlier, maybe at 55. And so I've always heard and believed it's important to retire and have something to retire to because there's nothing worse than just sitting around. You've worked for 30, 40 years of your life perhaps, and then what do you do when all of a sudden you either have retired or maybe had to leave the workplace for some reason, that there's these wonderful opportunities between both of the programs for people to get involved with. And on both sides of the financial spectrum, because I used to always hear volunteers, I'd love to have more people be foster grandparents or senior companions. Why do they have to be at that income level? Well, then you've got RSVP to handle the other side of that as well, doing similar work. So roughly how many volunteers do you have in your programs, ladies?
In our foster grandparent program, we have 90. We service Muskegon, Newaygo, and Lake counties. And in our senior companion program, we service Muskegon and Newaygo counties, and we have 17 volunteers in that program right now.
And that's probably limited because of funding.
Yes, yes. Actually, the senior companion program is under the corporation's guidelines and regulations, but they don't fund the program. We actually receive funding from community agencies and state agencies for that program. So that's a little bit smaller program, whereas the foster grandparent program does receive federal funds from the corporation along with the state and community funds.
Okay. And LaTanya, what do you have roughly in RSVP?
We're right in the neighborhood of 70, but we're looking every day for more individuals to come through the door.
There's more capacity.
Oh yeah, absolutely. So we invite you to come and see us.
You can get contact information in a little bit there.
Absolutely.
So we know that our population is aging. The baby boomers, and I'm at the tail end of that group, as I always say, we're going to have a lot more older adults in the next 5 to 10 years, which is great to have these programs for them. So, Beth, what would you say to somebody who might be thinking about, somebody who might be watching, who does fall into that 200% of poverty level and thinking, wow, I've got some time?
I would just say to that person to really embrace your talents and your God-given gifts and just share those with others, whether it be a child or an adult that might need some assistance. Really think about how you could help someone else, but in return, just realize that you're going to also benefit yourself. You really benefit health-wise even by volunteering, keeping yourself active and engaged in community. So there's really nothing to lose by doing this.
I have to say, when a few years ago I was fortunate to be able to interview some of your senior companions and foster grandparents, and we were asking them kind of satisfaction questions and asking them what they got out of it. I remember more than one person, at least 2 to 3 out of the 10 or 12 that I interviewed, saying, it gives me a reason to get out of bed in the morning.
Yes.
And
yes.
and we've done a lot of focus at Senior Resources on social isolation and the really negative health impacts
Yeah.
of that. There are studies that say it's like smoking 15 cigarettes a day when you're socially isolated. And both of those programs help.
Yes.
Both, and then
Yes.
your senior companion is helping seniors on both ends, those who are giving the service and those who are receiving it,
Right.
because we have participants in that. But the stories of that, and I've seen them as part of videos before, and to hear the foster granny, and they're mostly grannies.
Yes.
Not as many.
We do. We have. Yes, we do have a couple of them, so I can't exclude them for sure.
But they would talk about how wonderful it was to walk into that classroom and the kids are just swarming them because they have a
Yes.
few usually each that they work with regularly.
Yes. They're usually assigned up to 6 children.
So they're really bonding with those
Yes.
kids because they're seeing them regularly depending on how
Yep.
many hours that they're working. Now, what about the senior companions? Are they assigned just one person or do they have more than one person that they're helping?
Usually with the Senior Companion program, the volunteers are matched with their clients, which is a great process because it's not a perfect world and we all have different personalities. So you really want to make sure you have a good match between the client and volunteer. So the volunteers usually assign between 3 and 4. I think 4 is the limit for one volunteer to have assigned to them, but it stays consistent so that there's that relationship building between those clients and volunteers.
And I'll share a story because
So.
you gave me a story that I
Okay.
was looking for one last year about a senior companion who was helping a participant who, and just the changes that she saw in her being willing to get dressed, where before,
Yes.
and the names are escaping me at the moment, but we'll say Sue. Sue was not wanting to really get dressed and really wasn't just not excited about that. And her senior companion came along and they would go out and just go for a drive down to the beach because she really enjoyed seeing the beach, or thrift store shopping. They
Thrift
were very
stores,
big
that's
on
huge,
that.
yes.
Oh, yeah.
And so I think the day that I met her, she was showing me the tennis shoes that one pair that she'd got. But she got so she was more, when her senior companion would come, she'd be dressed.
Yeah.
Where before, a few months earlier, she'd still been in her pajamas.
Yeah.
But she started looking forward to those visits. And as I recall, she had a visual impairment.
Yes.
But
Yes.
I remember her senior companion saying, "Oh, she can see just fine when she wants to."
Right,
She can tell
right.
if I'm doing something she doesn't like.
Yeah.
But the bond between them was very evident.
Yes.
It was really
yes.
fun.
It's priceless.
So, LaTanya, same question. Why should somebody join RSVP?
Well, we're very dedicated to identifying what it is that you want to do. You know, we really pride ourselves on being able to listen to that and pair you with those connections that you want to make. You're at a valuable place in life, you know, and every day is a gift that you donate to us. And we want to honor that and give it the homage that it deserves. And so we definitely take pride on taking care of our seniors. You know, we want to train you, we want to prepare you, we want to get you involved in the way that you want to do. And so we really take pride on listening to the volunteer, listening to what the community needs are, and trying to pair them really, really good together. A person looking just much like Beth here indicated, a person who's looking to, avoid some of that downtime after retirement. You can take your time and you kind of coin it the way you want to do it. And so, being a part of RSVP, you get to say, oh, I have an hour this week, or, I want to commit to a year's term, but I want to do it on my terms. And so we give you ownership to kind of direct your path in that way. We give you a great menu, and so we really, take pride on that as well, that, we've heard what the community needs, being very, very involved with United Way of the Lakeshore. We've done the community need assessment, and so we've heard what the community says that they need help in. Education being a big primary focus of that, healthcare being another, economic opportunities being another. So we're really trying to invest those seniors who want to give their time and treasure and put them where they want to be. So we want to take care of you.
How should they get a hold of you? What number should they call?
They should call 231-332-4018. That's my direct line. I also have a coordinator's line at the 231-332-4007. Please call us, and we'd love to hear from you.
And Beth, how would they get a hold of you?
They would call 231-727-4140. And any option 1, 2, or 3, you will get a hold of somebody, and we welcome all calls. We'd love to talk to you about the opportunities available.
Great. Well, we have just a couple of minutes, so I'm going to revisit what I said early on. And I'm going to make the plea, but I know these ladies echo it. So the program funding is a really big concern. And I will emphasize the president proposes a budget, but it is not up to the president to make that budget happen. That is up to our Congress people, so the House of Representatives and the Senate. So we think that these programs are a great value for our older adults and for the entire community. Helping young children learn to read, helping frail elderly people remain engaged and stay home, and helping the seniors who are helping on those two areas stay active and engaged and healthy. All of them help keep them that way. And so if you feel strongly about those programs, as Congress is looking at that budget right now, and that is proposed to be zeroed out, and we don't want that, you need to get a hold of your people. In Muskegon, your representative is Representative Bill Huizenga, or you can contact Senators Debbie Stabenow or Gary Peters. Again, you can find their contact information on the Senior Resources website. If you can't remember any of that, if you can't remember that you need to call RSVP at 231-332-4007 or 231-727-4140 for foster grandparents or senior companions, you can always call 211. 211 is that 24-hour helpline that can get you connected to just about anything you need, and I'm always pushing that because it's 3 digits and you can remember that. Ladies, we've got about 30 seconds left. Anything left that you need to say that we've missed?
I would just encourage everybody to take the opportunity to come see what these programs are about and come join us.
Yes. I would also piggyback on that and just say, give it a shot. Give it a shot.
So again, make sure that you're letting your representatives know your feelings. Tell people about these programs. If you're looking, you've got some extra time and you're 55 and older, get a hold of LaTanya, get a hold of Beth, or their wonderful staffs that work with them. If you can't remember that, remember 211, or you can always call the Volunteer Center at United Way as well, and I can't remember that direct line, but I know you can call 722-3134 and get to United Way that way, and make sure that they can connect you to something, and if you tell them the age, they're probably going to try to connect you to one of these ladies.
Absolutely.
So thank you so much, Beth and LaTanya, for
Thank
joining
you.
us this month. Lots of great information. We're going to keep our older adults happy and healthy and engaged if it kills us.
That's our goal. That's our goal.
Absolutely.
We appreciate you joining us for this half hour of great information. We will see you next month with another great topic. Thank you.